And the features that we may observe in association with hind limb lameness are a failure to extend the hind fetlocks, a lack of separation between placement of the hind limbs, both temporally and spatially, loss of the 3-time canter, so-called bunny hopping, lack of a suspension phase, becoming disunited or cross-cantering behind, and showing difficulties in movements such as pirouettes or canter flying changes. Look at the 2 bottom photographs and observe the difference in the spatial separation of the hind limbs in the left canter pirouette compared with the right canter pirouette. The horse is reluctant to load fully on the left hind limb and wants to put the right hind limb down much quicker than it might otherwise do, to share the load between the 2 hind limbs. So I cannot see lameness in canter, but canter can highlight the presence of problems both behind and in front. So this horse has little suspension. The tail is held slightly to the left. There is reduced range of motion of the thoracolumboSacral region. The horse had bilateral hind limb proximal suspensory desmopathy, and when the suspensory ligaments were blocked, the quality of the canter was much improved. The horse on the right is moving on 3 tracks. It's croup high. The tail is held to the left. This horse has wide spatial separation of the hind limbs, and then they're for a while placed slightly closer together. The horse has a short stepping forelimb gait. This horse had both hind limb lameness associated with proximal suspensory desmopathy and bilateral front foot pain. See how the horse steps short behind in the downward transition from canter to trot. A reflection of its unwillingness to engage the hind limbs due to bilateral hind limb lameness. This horse has a horrible canter. It's on the forehand. The horse bucks and kicks out. It looks very uncomfortable. It's resistant. It breaks spontaneously from canter to trot and is reluctant to re-establish canter. This is a horse with primary lumbosacroiliac joint region pain. Performing lateral work may be the only circumstances under which hind limb lameness is apparent. However, the rider must be sufficiently skilled to ride the movements correctly with an adequate degree of collection. So this horse is performing quarters in on a circle, preparatory for canter pirouette. We can see those variable spatial and temporal separation of the hind limbs, and the horse tries to jump out of the movement. This was also a horse with bilateral hind limb proximal suspensory desmopathy. No overt lameness could be seen under any other circumstance. So if a horse moves symmetrically, we have to ask, is it in balance? Are stride length, impulsion and engagement what you would expect to see from a horse of that type? What does the rider feel? If we can't see lameness, reassess the horse after working and standing still for at least an hour.